Hello everyone. So how do we monitor twin pregnancies using ultrasound? Well, according to the ISWAG guideline on twin pregnancy, whether the pregnancy is dichorionic or monochorionic, the first trimester scan happens at 11 to 14 weeks. And during the scan, you determine the chorionicity, you date the pregnancy, whether according to the larger crown rump length or according to the IVF dates. And you label each twin with as much information as possible using the placenta location, perhaps the cord insertion and the fetal gender. And you offer screening for chromosome abnormalities according to where you work and the patient wishes. In dichorionic twins, the next scan will be at the 20-week anomaly scan, and during the scan you will measure the fetal biometry, you look at the anatomy for major abnormalities, and you evaluate the amniotic fluid volume, and you measure the cervical length to identify the pregnancies at high risk of early preterm birth. Obviously, that can vary from one country to another, depending whether they recommend screening for preterm birth or not. After that, the scan should happen every 4 weeks until the end of the pregnancy, because we are monitoring for fetal growth restriction in twins. So at each scan, you will measure the biometry, you estimate the fetal the weight discordance, you assess the amniotic fluid volume and the ISWA guideline, including assessment of the fetal Doppler. I know this is controversial, and not all guidelines do recommend assessment of fetal Dopplers if the biometry and amniotic fluid volume are normal. For monochorionic twin pregnancy, is a different story. So from 16 weeks, the scan should happen every 2 weeks. So every 2 weeks from 16 weeks until the end of the pregnancy, because we are monitoring for twin-to-twin transfusion syndrome as well as fetal growth restriction. So for at every scan, we measure the biometry for each twin. We calculate the discordance and measure the deepest vertical pocket. And again, I know this is can be controversial whether people just assess amniotic fluid volume or measure the deepest vertical pocket, but certainly the guideline do recommend measuring the deepest vertical pocket in each twin. And also the ISWA guideline did include assessment of the umbilical artery at every scan, and assessment of the MCA or middle cerebral artery peak systolic velocity from 20 weeks onwards to monitor for development of TAPS or twin anemia polycythemia sequence. Again, this is controversial, and it's not all the guidelines do recommend routine assessment of the middle cerebral artery peak systolic velocity at every scan. And similar to dichorionic twins, so at 20-week, the recommendation is to measure the cervical length if you want to screen for preterm birth in twin pregnancies. I hope that's useful, and thank you for your attention.